Hi, I'm Sian, one of the news editors at Manx Radio. Now, what's going on at Manx Care? We've heard reports of patients having their appointments cancelled, and MHKs have been asking for answers over just what's going on in the health service. Last night, former Health Minister Lori Hooper leaked an embargoed press release sent to the media earlier this month that listed a series of cuts which still hasn't been announced to the public. Myself and Ben took a look at the issue on this morning's Manx Radio Breakfast.
Let's get back into our main story because there's a lot to talk about here and a lot of you getting in touch as well. The former Health Minister says government is essentially holding a gun to the head of the Manx people by sanctioning rumoured health cuts. This is Ramsey MHK Lori Hooper, who's took to social media this week to ask his constituents to inform him if they've found that their upcoming surgeries have been cancelled or postponed. It comes as an urgent question from another MHK was delayed in the House of Keys this week as the Health Minister, Claire Christian, wasn't in attendance. What do we know about this so far? Siobhan Fletcher has this report.
The reality is, because council ministers seems to be making these kind of short-sighted decisions, and it's very chaotic at the minute because no one knows what's going on and no one wants to stand up and be accountable and responsible for it. Actually, it's impossible to deal with this, and I think you've said it, is it ironic? I think it's criminal, actually, that the council minister started off with a long-term plan to help improve the health service and reduce waiting lists, and when the crunch time has come, they've turned around and gone, actually, no, we're not committed to that anymore, and they've almost pulled the rug out from under their own feet. They're starting to undo a lot of the good work that has been done.
Former Health Minister and Ramsey MHK Lori Hooper there, and we'll come back to him in a minute. But how did we get to this point and what actually is going on within Manx Care? Well, let me set the scene for you. Last week, Douglas East MHK Joni Farragher tabled an urgent question ahead of this Tuesday's House of Keys sitting about whether elective surgeries are being reduced. She wanted to ask the DHSC if any other cuts to services are being proposed or planned. It came after Manx Care and the department renegotiated a pay deal with doctors last week who were threatening to walk out. That deal was accepted by the BMA's members yesterday. But when that deal was announced in Tynwald last week, the Health Minister told members she was not aware of any planned cuts by Manx Care to pay for it. Lori Hooper told his replacement her answers didn't stack up. Well, since then, we've heard from you, our listeners, who've told us you're starting to see impacts on services. News editor Tessa Hawley is with me now. Tessa, what exactly have we been hearing?
So one caller told us the person they spoke to at a hospital in Liverpool didn't realise that they were an Isle of Man patient. They say they were told the government is not funding any operations apart from emergencies classed as P1 till the end of March. This listener is classified as a P2 patient and they said they are at a loss. Another told us a family member who was at Aintree Hospital this week for an injection said the doctor told him that from this Friday they're not allowed to treat any patients from the Isle of Man until the end of March due to Manx Care having no money to pay for it. Now, Chanel Suku spoke to someone else on the phone who would like to remain anonymous.
I was a bit taken aback when they told me that the list was already full. The doctor wasn't coming next month at all. They didn't think he'd be coming the following month, and they didn't know what was happening after that. And that's when I said, well, are you waiting then to see what money you're going to have at the beginning of the financial year in April? And she said, well, yes.
A patient from the Isle of Man speaking to Chanel there. And Tessa, we've heard from someone within the hospital here too, haven't we?
Yes, we've heard from a medical professional at Nobles who also wants to remain anonymous. Now, they told us that Manx Care has requested that the Liverpool University hospitals stop treating Isle of Man patients except in emergencies for financial reasons. And that's until the end of this financial year. They've told us that Manx Care will not pay for any outpatient appointments or surgical procedures after the 1st of February that are not classed as emergency treatment. Now, with regards to that allegation, we contacted the Liverpool University hospitals for comment, who told us, we suggest you talk to Manx Care.
Well, we have, of course, contacted Manx Care for comment, along with the Department of Health and Social Care. Now, back to former Health Minister Laurie Hooper, who told me about his concerns if these allegations prove to be true.
I've heard people tell me that no patients from the end of January are going to be accepted. I've seen information that suggests that surgeons on the Isle of Man have had their lists cancelled and that some surgeons may have lost all of their surgical lists, and that at the moment the proposal is that they're only going to be accepting cancer or urgent surgeries. So anything that's non-cancer, not urgent, could be cancelled. So lots of this noise coming out. The challenge is trying to triangulate some of it. So I have reached out to Manx Care and said, look, this is what I'm hearing. Someone needs to tell us what's going on here, because the minister has said there will be no cuts. Evidently, that wasn't entirely accurate. There are definitely cuts happening because patients and medics and staff are all talking about this. We know this is going on. But the government is absent. They're missing in action on this. We haven't heard anything from them other than for them to deny that any cuts were coming.
Are you grandstanding slightly from a position of knowledge? Because the picture can't have changed much since you were a minister. I mean, surely it could be argued some of these issues were legacy issues.
No, the position has changed substantially. So one of the reasons I resigned from the post was because back in October I went to the Council of Ministers and I said to them very explicitly, you've got two choices. You either need to accept you need to fund healthcare properly, or Manx Care are going to end up having to cut services, because that's where they're at. They're at the stage where they've done pretty much everything they can to make these savings quickly. But if you want these savings to be made quickly and at the level that you're talking about, so tens of millions, and you want them to happen now, the only way to do that is to affect patients. And I told the Council of Ministers I wouldn't do that. I flat out refused.
Right before you left, and we had that first raft of cuts from Manx Care, the current Health Minister, when she was a backbencher, Claire Christian, said that Manx Care was holding a gun to the head of government. Do you now then think that government is holding a gun to the head of Manx Care?
I think it's worse than that, actually. I think government is essentially holding a gun to the heads of Manx people.
That's former Health Minister Laurie Hooper, MHK, speaking to Siobhan. Well, this story took another significant twist yesterday evening when Mr. Hooper took to social media again to share a link to his website where he leaked an embargoed media release from a couple of weeks ago. It was sent from Manx Care's communications team. Sian, you've been looking at all of this, so what do we know about this media release?
So I can say that we did receive that media release on the 15th of January. It was embargoed until 4 p.m. on the 16th of January and outlined a number of measures that Manx Care was planning to implement to get on top of the financial challenges that they've been facing. However, later that day on the 15th, it was recalled. We were told the embargo was being extended and asked not to release the contents of that media release. We were told that this was because the implementation of the mitigations were being considered. So at this point, we still don't know if what was in that media release is the definitive list of changes that Manx Care are looking to or have implemented.
And it's really important to clarify that point, because this was a couple of weeks ago now. Things could well have changed. It's really important to say that actually this is not definitive.
Yeah, this happens with embargoed media releases all the time, that they will change, they'll move, they'll get recalled, and you'll get a new version that's slightly different. They can be recalled for any reason, from they want to tweak the embargo slightly to something has completely changed. And we've seen with the doctor strike, for example, that in healthcare, particularly when you have that political side and the operational side, there can be quite big changes very quickly.
Well, the contents of this release from a couple of weeks ago are now in the public domain. Mr. Hooper leaking the release last night. So what does it tell us?
So it outlines a number of what Manx Care describe as key measures that they're looking to implement. That includes the temporary suspension of elective operations. These are non-urgent and non-time critical elective procedures, and the plan was to pause those until March or April this year. It includes inpatient ward closures, select wards being temporarily closed in response to the suspension of those operations, a recruitment and vacancy freeze, a centralised oversight of job planning, and what they describe as strengthened financial controls to try and get a tighter control on some of their spending.
So as we say, this was released 2 weeks ago. It was a record, so a couple of weeks on from that. You can read that release and indeed the full story. As we say, there's really such a lot to talk about here. It's all there now at manxradio.com. Worth just quickly mentioning as well, Sian, we know of the word embargo, but it's really important when embargoes are put on media releases, particularly regarding health, potentially sensitive issues and topics, that the media respects those embargoes, hence why Manx Radio did not publish this release a couple of weeks back.
Yeah, it very much works on trust embargoes. So, if we break an embargo one time, we might not get it under embargo next time. And it just gives us a bit more time when it is something quite complex like this to have a chance to speak to someone from, in this case, Manx Care in advance, and just make sure that when we hit publish on our story, we are giving you absolutely everything. We're giving you as full and as detailed story as we can. And
we've had a number of our listeners getting in touch with various stories over the last few days. And as you mentioned before, we're really grateful to those listeners for speaking to us.
Yeah, and the types of stories that we have been hearing, the types of procedures that have been affected, it does very much tally with what was outlined in that media release a couple of weeks ago now. But it would just still be quite useful, I think, to have that definitive, yes, this is what's happened, or actually this is what's happening from Manx Care.
So what on earth is going on? There are so many questions. We have obviously approached Manx Care and the Department of Health and Social Care to respond to all of this and give us and you, our listeners, the Manx taxpayers, Isle of Man residents, what is happening with our health service. So we've invited Manx Care and the DHSC to speak to us on the programme this morning or at any point. Manx Care's Chief Executive, Teresa Cope. We made repeated attempts during the proposed doctor strike, Sian, over the last couple of weeks to speak to Mrs. Cope or somebody senior from Manx Care. Through that time, we did have various statements, but we've not spoken to anybody from the organisation, actually spoken to them, because we are a radio station for quite some time.
No, I don't think we have. And of course, it's very much an offer that remains open. We are very, very keen to speak to Manx Care.
And the Department of Health and Social Care as well, the Minister Claire Christian. More than welcome to join us on the programme this morning at any point today. It is an open invite, so get in touch. Let us know what is going on. Well, the topic of that embargoed press release came up during Siobhan's interview with Laurie Hooper yesterday. He questioned why governments are willing to brief the media but are refusing to update Tynwald or let the media use the information they've been given.
The other thing that makes me worried about this is I am aware that the week before the Tynwald sitting, a press release was sent out under embargo to news organisations, which advised them that cuts were coming. So even at the point when we were in Tynwald talking about these things, the Minister must have been aware that this had gone out and that these cuts were coming. So the longer we wait, the more information is coming in that this is happening, contrary to what Tynwald has been told. And that raises serious alarm bells.
So just to sort of completely set it in stone here, so have Manx politicians had any briefings from Manx Care or the DHSC about potential cuts?
No, we've had absolutely nothing. The last time we talked about cuts, the Council of Ministers advised Tynwald that they had thrown all the cuts back to Manx Care. They'd rejected all of them, apart from a few things which they'd listed to us at the time. And since then, the Minister has refused to comment on cuts up until last week, where she confirmed to Tynwald that no cuts were coming. She wasn't aware of any cuts. We didn't need to worry about that. There were no cuts happening. So no, we haven't had any information from it. Other than, like I say, Ms Farragher tabled that urgent question, and I think we were hoping we would get an answer either on the floor, obviously, and then when it was apparent that the Minister wasn't going to be present, I think a number of us thought we might get something circulated, or we were expecting a press release. But no, we haven't had anything, which makes it even more frustrating that I know that they told the media, but are refusing to tell Tynwald, and are refusing to allow the media to use the information they've been given. There is something going on here, and government just doesn't want to talk about it.
Yeah, I think just to sort of clarify for listeners, I mean, in terms of from the journalistic side, as you know, when we get any embargoed press releases, it's embargoed, so we cannot release that information. It's not a big cover up, it's not anything like that. It's just that usually we get it and maybe we have a briefing, or you saw in the COVID days we had public briefings where we were on the radio, and we've been given an indefinite embargo on that. I think our question, and speaking from the media then, to go back on that, our confusion has been why no politicians have used parliamentary sort of privilege to bring it up in Tynwald or Keys. But you're saying that opportunity was going to be this week.
And that's the point. So we tried to do that. And the government, like I say, when the Minister wasn't there, normally somebody else would step in, especially on a matter like this that was urgent, that is of national importance, that obviously there's a lot of concern about, something that is really going to impact people. But no one else was willing to answer the question. And the government didn't put anyone else forward. So the opportunity we had evaporated in front of us, and that really pulled the rug, I think, out from some of us who were hoping to have this conversation in public in Parliament. We suddenly weren't able to do that, and normally when that happens, something like this, I would have thought there would have been an email, a note, a press statement, something that informs us what's going on, even if it was just a statement to say, sorry, I think you've misunderstood, don't worry, it isn't as bad as all that. But actually, that hasn't happened, and the more I'm hearing from people, the more people that are emailing or messaging or calling, it does feel like it's as bad as it's made out to be. And I don't understand why the government isn't standing up and being honest with people about this. It's clearly, you can't keep a secret on the Isle of Man at the best of times, but something like this is definitely not going to go away quietly.
All right, that's Laurie Hooper speaking to Siobhan. You can hear that interview in full. It's certainly an interesting listen. It's available now as a newscast at manxradio.com or wherever you get your podcasts. So, your thoughts on this? What do you reckon? 166 177 studio at manxradio.com. A lot of you have been in touch. Let's start with this comment on Manx Radio's Facebook page from Bridge, who says, what on earth is going on? Well done, Minister Hooper, for exposing this embargoed Manx Care press release from the 15th of January, confirming, well, it did at the time, a halt on elective surgeries. As we say, 2 weeks on from that, we're not entirely sure exactly what is still in place from those measures announced. But ward closures, recruitment freezes to help manage financial pressures, etc., says Bridge. Yet, on the 21st of January, the now Minister for Health, Claire Christian, told Tynwald there weren't any planned cuts, raising serious questions about transparency. Reports on Manx Radio suggest Isle of Man patients are now facing restrictions on any off-island treatment. So why was this important information withheld beyond the embargo date? Exactly how will these changes impact those patients needing urgent care? We, the public, deserve clarity and honesty regarding what's happening with our healthcare services.
And David's been in touch to say Manx Care have refused to send our child to Alder Hay today for his appointment after emergency surgery last week due to funding. I'd be happy to discuss this, and I'd like it to be made public what Manx Care are doing. David, one of our reporters will be in touch. We would really like to hear more about your story.
And again, just to reiterate, a lot of you have been in touch with your various stories over the last few days and experiences. And again, we are really grateful to you for getting in touch. We're asking the big question this morning. We're trying to get an answer to this, I can assure you of that. Are there going to be cuts to the health service here on the Isle of Man? If you've been affected by any cuts over the last couple of weeks, as we've been telling you, a number of you have been in touch about some changes and cuts and so forth, and we really appreciate you getting in touch. So if you've been affected in any way over the last couple of weeks, do let us know. 166 177, email studio at manxradio.com. Yesterday, Laurie Hooper took to social media to share a link to his website where he leaked an embargoed media release from a couple of weeks ago from Manx Care's communications team. The announcement outlined a fresh set of urgent measures which the health body said it was going to impose in the hope of bringing down its overspend this financial year. Sean, let's just recap on that. That media release was recalled, so we don't know in terms of what's in it exactly how much is sort of going to come to pass, as it were.
Yeah, it was recalled ahead of the embargo. It was embargoed until the 16th of January. We were told that Manx Care was considering the mitigations again. So we don't know if what is in that release is 100% the definitive list of cuts that Manx Care will or have made. We're still waiting to get some more clarity on that.
There's an awful lot going on here. You can recap the full story at manxradio.com. We've heard extensively from the former Health Minister, Laurie Hooper. We know Joni Farragher was set to ask that urgent question about this in Keys earlier this week, but the Health Minister wasn't in the chamber. It's because she was absent through sickness, I believe, Sean?
Yeah, she was unwell, and for whatever reason, no one else was able to answer. Sometimes if a minister isn't there, a political member for the department will step in. We know that there were some of those in the chamber, but they decided not to take it on the day. And
as it stands, this question is set to be asked in Keys next Tuesday of next week.
Yes, initially we thought perhaps Joni Farragher would take a written answer instead, but we understand she wants that oral answer. So we haven't seen an order paper yet, but we are expecting it to be on there for Tuesday next week.
Well, you've got your eyes across the socials this morning, and there has been further political reaction to this. A couple of members fairly concerned about, I say these announcements, the various things that have come to light, shall we say, over the last 24 hours or so.
Yes, the MHK for Albury, Castletown and Maloo, Tim Glover, says it's time to come clean. Government, Manx Care and Department of Health and Social Care, all the usual buzzwords to not tell the truth. Have services been cut? Hearing the same as Joni Farragher and Laurie Hooper. Same with education, reallocation of resources, and other such phrases. In reality is cuts. How stupid do you think people are? The longer a series of bluffs are put out, the deeper you will be in regaining any credibility. And also the another former health minister, Rob Callister, he's posted on social media, as a publicly elected member of the House of Keys for Onken, I find it deeply troubling that significant matters are unfolding behind the scenes without any official statements in either Tynwald or the House of Keys. This lack of transparency is disrespectful to honourable members and to the constituents we've been elected to serve. Serious questions must be answered in next week's House of Keys.
Yeah, there are so many unanswered questions regarding this. So just to tell you once again, we have contacted Manx Care and the Department of Health and Social Care to respond to all of this and hopefully give us some clarity on exactly what is or isn't happening. We'd really like to speak to Manx Care's Chief Executive, Theresa Cope, and the Health Minister, Claire Christian. So those invites have been extended, or indeed anybody senior from either organisation. As soon as we have a response, we will, of course, let you know.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.